Nurses are healers. When you're sick or injured, nurses want to heal you, period. A major role of nursing is centered on patient advocacy. So for nurses, fighting for a humane healthcare system is the ultimate way to advocate for their patients. We're proud to stand here today with many of our partners who are joining us in that advocacy. Join with me. Everybody in, nobody out. Everybody in, nobody out. Everybody in, nobody out. Everybody in, nobody out. Woo! Yeah!
We love nurses. We love people who care about others. We love universal health care. Thanks for being here.
So that was Senator John Marty. We got Senator Scott Dibble. We got Representative Tina Labeling. We've got Representative Aaron Murphy and Representative David Bly. And Representative Aaron Cagle. I'm sorry.
Farmers don't have cash. We have assets. And because of that, we can't pay for the health insurance sometimes.
Small businesses are another group that is very much in favor of healthcare options that work for all of us. Private health insurance industry options fall far short. We need MinnesotaCare as an additional reliable choice to minimize our uncertainty from year to year and to stabilize the marketplace. MinnesotaCare is a proven program that provides excellent coverage and will allow more Minnesotans to keep the doctors they want.
I work in the trauma neurointensive care at North Memorial. One night, this stands out in my mind, I had two patients that were there because they had fallen. They had a diabetic crisis, they fell, and they were both intubated, meaning they were on breathing tubes, so they're in the intensive care. 3 o'clock in the morning, we'll call him Harold. Harold had his breathing tube removed, and I say to him, I said, Harold, how did this happen, Harold? You weren't taking your insulin. How did this happen? And guys, it was the way he said it. It was that defeated way that he said it. He goes, well, Mary, I ran out of money. The second person that I'd gotten a report on that still was intubated, the report I got was this gentleman did have money. He could afford his insulin. However, his son was also diabetic. And so he was giving half of his medicine to his son so that he could live. He fell and ended up in the ICU. My point to the Senate committee that I told this story to last year was that insulin at the time cost around $500 a month for a diabetic, $500 a month. At that time last year, it was roughly $6,000 to $8,000 a day to spend in the North Memorial ICU. I told the Senate committee, I said, you all do the math. You all do the math. What makes sense? We need insurance coverage that will cover people's drugs so that they don't end up. We see this all the time, people being uninsured and ending up at much greater costs in our intensive cares and in our hospitals.
And those next 3 steps first are calling your senator and representative and Governor Dayton and urging them to stand up and continue to fight for MinnesotaCare for all and against corporate insurance taxpayer giveaways.
In just a couple minutes, we're going to collect them all, and then you're going to follow me and the speakers who are up here today, and we're going to lead you over to Governor Dayton's office, and we're going to present these Valentines to him on Valentine's Day, thanking him for doing the right thing, taking on this challenge, and pushing back against the corporatization of healthcare.